given. So we need to appreciate that. But I think the other investment that's needed is on information, on implementation, on education, the entire, and on sanitation. Sanitation is a massive component. So again, investment comes from monetary, it comes from goodwill, but it also comes from a programmatic point of view. We need to invest in, I mean, this was 2020 when Inua Dada spoke to a group of pregnant teens and teen moms. Almost all of them said they could not link their pregnancy to their period. And this was 2020. This is not like 7 years ago. So the fact that in 2020, you have 14, 15, 16-year-olds who are pregnant and didn't know they could get pregnant because of their periods. Surely, what are we doing? We're not educating enough. And when I asked them, I said, but don't you have a lot of programs coming to you? Some of them said, yeah, we have, but sometimes they don't reach everyone. Some of them said, no, nobody has ever talked to us about it, even our teachers, even our parents. So there's an information gap. And because of that information gap, it speaks to the fact that they don't have information. And it speaks to the fact that to some extension, some of them also didn't have access to period products. So we need to invest in information sharing. We need it to be the way we've talked about it, the way we've talked about massive intentional campaigns, that there's no family, woman, man, girl, boy in the country that doesn't know the link between reproductive health and rights and, reproductive health and rights and pregnancy. Then we need to include the community. Community champions, the work in the community is so amazing, but are we uplifting them? The community champions are also finding themselves stretched. They're stretched thin, they're overwhelmed. Why are we not backing them up? They are essentially the people who can solve so many of our issues. We just provide the platforms and we provide the platforms for them to showcase their work, and we provide an opportunity to maybe fund where possible. And finally, I think it's just in investing in caring about each other. Again, I'll go back to the thing about political goodwill, national goodwill. If you care about people, you'll protect them, you'll give them the kind of access they need. Scotland cares about their girls and women, and they decided that they'll have access to pads for free or sanitary products. New Zealand are in the same boat. And it's not so much because the people behind those causes were women, because it's true, the MP, Annie Lennox in Scotland, it's a woman, and in New Zealand, it's Jacinda Ardern. But also the people who really made those things possible were their male counterparts and MPs. So if people care enough for their citizens, if people care enough for their countries, if people care enough to see women and girls compete, then they will invest in the information, in the funding, in the national resources and goodwill to make sure that access to information and products is free. Hello, Ina. I had to just say hi to her. Another massive period champion. I'm a fan.
Yeah.
Good to see you.
Same, likewise.
Yeah, Victor, I hope I've answered your question.
You have. Thank you so much. I'm going to allow you to take a breather. I know you've been talking for a few minutes. So, Ina is here. Ina, you're very much welcome. We've introduced you earlier, but I'm just going to read a bit about you. Ina Jugra, am I pronouncing that right, Ina?
It's like yoga. It's like yoga.
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 She's a media personality, founder of, has more than 60 years of profound experience in WASH, with a focus during the last 10 years on menstrual health and hygiene. Working for WASH United, she co-initiated the Global Menstrual Hygiene Day. Thank you so much, for which is the international coordinator since 2014. Aside from working on partnerships, knowledge management and advocacy on menstrual health and hygiene all year round, she's also heavily invested in WASH United's Menstrual Health and Hygiene Education Guide, which is freely available for partners in Africa and Asia. We are so glad to have you, Ina, and I'm gonna ask you a few questions. After a few minutes, let me go to Elsie. Janet talked a bit about investment, and I know one of the things that you have done particularly is to invest on victims of gender-based violence and what to do to support them. So what is the link? Share with us the link between gender-based violence and menstrual health and hygiene.
Great, thanks, Victor. So sexual and gender-based violence is multifaceted. It occurs either in a physical form or a psychological form. But let's talk menstrual products. Let's talk sanitary pads. One thing about them is they're expensive. Who are the users? The women and girls. Who are the providers? The men. And there it occurs. It's something that is used to bring upon not just psychological abuse, but also economical abuse, in the sense of I can literally manipulate you into doing something so that I can give you money or buy you that particular product. So that is one of a myriad of ways that SGBV is linked to menstrual hygiene. But other than that, there's been a growing increase, particularly in Kenya, and particularly over the pandemic, where young girls who are at home over the lockdown and restrictions were engaging in transactional sex so that they can be able to purchase such items, such as sanitary pads. Of course, the pandemic brought so much hardships for us and our families, economic hardships, that is. And so it was literally a balance of, do I sit in the house, use a piece of cloth for 3 to 5 days, or be able to move freely, see my friends, see my neighbors, and how then would I get to do that? And ironically, a lot of men were taking advantage of these young girls who are underage, and of course, easily coerced into such transactions. And so that's something that we've witnessed. And for as low as 50 Kenyan shillings, which is something that I think needed to be highlighted, not just over the pandemic. This is something that I think the pandemic has brought to the forefront of period poverty and menstrual hygiene. But it's something that, like Janet was saying, should be at the forefront, should be spoken about. Again, speaking about menstrual hygiene, a lot of people shy away. As Janet said, we engage men and boys. It's something that we should be open to talk about. These are realities that are happening here in Kenya. Just to link SGPV and menstrual hygiene and poverty, one of the things that happens is that once young girls begin menstruating, in some communities, particularly in Kenya, then they're seen to be ready for marriage, whether you're over 18 or not. And so this is leading to actually an increase in that sort of taboo and cultural perception that is in Kenya, where now you're a woman, as soon as you start menstruating, is literally leading to increase in SGBV. One of those being early child marriage. Other than early child marriage, the same in some communities, once you start your menses, then you're good to go for female genital mutilation, which is also another physical form of SGBV. And so you can see how all this sort of interlinks with menstrual hygiene. But as we talk of menstrual hygiene, can we talk about the vulnerable in our society? Can we talk about how they lack access to sanitation? I mean, if I have to literally walk a couple of kilometers from my crowded sort of roofing to be able to go to a public washroom, just so I can be able to, reuse another sanitary towel or so. I mean, I think it's really unfair. And like Janet was highlighting, it's time that we invest in menstrual hygiene now. And what are we going to do about it, particularly in schools and even at home? What can the government do? What government initiatives? Can the government now start listening to us as stakeholders and say, listen, we've heard you. We are going to at least put programs in place. I mean, personally in high school, I know I have given so many pads together with my classmates and housemates to some of us who are less fortunate and could not have it. At that time, of course, I couldn't internalize and realize how fortunate I even was to be able to afford those, or for my parents to afford those. So this is something that we need to talk about. It's a reality that is happening, and it's unfortunate that there are people out there manipulating and taking advantage of particularly young girls to coerce them into sex. And so, yeah, for me, that's the link. Thanks, Victor.
Thank you so much, Elsie, for that. I want to bring in Ina. Thank you, Ina. At a global level, you coordinate menstrual hygiene at a global level, and you get to see what happens in, well, all the continents actually, how the partners are responding, and you know what is happening, what is changing, and the countries that are still doing badly off, and the countries that are really improving on that. How does investing in MHM advance Agenda 2030, specifically SDGs?
Thanks, Victor. And once again, I'm really glad to be here among this great panel and with you all. I also feel sometimes I'm really almost Kenyan or East African. So yeah, really working with you since a long time. So I feel very glad to be here. So it's very clear that MHH is well situated to fulfill the Sustainable Development Goals. There are several that can be reached by fulfilling also good MHH. This is the SDGs on gender, the SDGs on health, the SDGs on WASH, the SDGs on education, but also SDGs around economic development, meaning more sustainable businesses. So unfortunately, when the SDGs were composed, that was back in 2015, the MHH wasn't that prominent. There's been a really big push by the WASH sector to integrate MHH indicator into the SDGs, into the sub-indicators, but that didn't happen because we were still too young, not too loud, and of course, a lot of conflicting indicators that had to compete. So it is very clear to all of us and also to many stakeholders and donors who invest how the MHH contributes to the SDGs. But because there's no indicator, it's very hard to track and also allocate funding to it. So it's just like we always have to say it's a proxy to this. So for example, very clearly within the SDGs for education that links to WASH infrastructure in schools, you measure improved school WASH infrastructure. But what is improved is actually not including so far menstrual hygiene management. It's just including, it's really the basic needs. And it could be an advanced indicator, but that has to be defined by the country. As we all say, what can't be measured is hardly done. So it was unfortunately a missed opportunity back then to not push for it further. But that should still not stop us from driving the SDG agenda, because I think a lot of countries and actors do realize the contributions, and also important monitoring tools like the Joint Monitoring Program, who measures, for example, WASH infrastructure. They're now increasingly looking also at indicators for menstrual health and hygiene, meaning access to pads, education, or period-friendly infrastructure. So that's a good thing. There's a lot of people who still push for it. Besides, it's not included. And well, it's in 9 years, and that's why we also put it as a theme for this year. We need more action and investment, because we are all committed under the SDGs that we leave no one behind, that we push to reach everyone. And let's be honest, we're like really practitioners who fight hard, but when we see left and right, we still have a long way to go. And we need to shout out more and convince more actors. But I'm very positive seeing, I mean, especially around Menstrual Hygiene Day, you see how big our movement has grown and how many actors came on board. So I expect by 2030, even if we didn't manage our goal, which I'm very sad about, I think we have enough voice and mandate to push for better integration of MHH.
Thank you, Ina. You've talked about WASH, and WASH is very holistic, and MHM is actually included in that. And when you touch a bit on MHM, a lot of partners respond more into the software bit of MHM. The hardware bit is often forgotten. And I think Janet alluded to this. How do we ensure that we respond holistically when we come to menstrual hygiene management? How do we ensure as partners that that can actually happen?
I think it's a little bit of the golden question. And like, let's say that's the silver question. The golden question is where to get more money. The silver question is how to work cross-sectoral, right?
Sectoral, yeah.
So yes, as I said, the WASH sector has been really upfront by starting with the issue, but I'm also really glad that we see more and more other sectors, like now, especially the SRHR sector, which we saw through the AC, MHM, UNFPA coming in strongly. So it doesn't have to be that me as a WASH actor, or like me virtually as a WASH actor, have to do now suddenly SRHR. I think that's unrealistic. Everybody should know their strength and also know where you have blind spots. So if I know I'm not good in building toilets or making them period friendly, but I know this is a really important component, I need to seek partnerships and partners who are good at that. And we have more and more also guidance and etc. So that is important. I know it's difficult also in a funding scenario where you receive money and sharing it and so on, but it's in every area of life. When it's good to, if you don't know, don't blame just ask people who know and seek for help. So I think it's also a matter of language. What I learned today, still, I was sitting in a component about sexual reproductive health and rights. They speak different language than we do from the WASH sector. So it's also about learning how to to get an understanding what this means. So, and this takes time. It also takes a little bit more resources. That's what we learned that is what I also learned this morning from a presentation from the Pacific. It's for me, like looking now at global level, it's exactly to convey that message to the donors, that when they set up programs, when they set to fund projects, that they fund consortia, or they make sure that this is holistically addressed, and not only funding goes to products, but that at least some of the key areas are assured, and that this requires more resources and eventually more time for coordinating. But this is so worthwhile, because how can you promote, for example, reusable washable cloth or cups, okay, but reusable washable cloths, if the school has not a running water tap or really proper soap and water in the school, and lack of education. I think that's always for me the entry point. So yeah, for me, and a call to us is just always bang on the door to say we want to work together with other partners and really establish these kind of consortia.
Thank you. I'm going to come back to you in a bit. Let me bring in Janet, and we want to talk about, touch a bit about the policy. So the policy was launched actually 1 year tomorrow. Yeah, exactly 1 year tomorrow. And Kenya really, was a very big step. Since the 1 year, just taking a bit of stock, what has happened? What are some of the, the milestones that we've achieved since the policy was launched 1 year ago? And what does the policy mean to menstruating women and girls?
Yeah, that's a good question. What it means is that there's a legal framework that now they are entitled to push and ask for their rights based on the fact that there's a legal framework that provides for how they can access information and products. Yeah, that was a great moment for the launch of the policy, which, I just got off a webinar which had somebody from the Ministry of Health, and it is one of the first of its kind from the continent. But I think there's been a lot of dissemination webinars and convenings on the same that have not quite yet translated to action. Could be because of the pandemic or other issues affecting it, but what we need is action. I love this year's theme of It's Time for Action Now, because like I mentioned earlier, we've had several conversations over the years. Where is the action? We have frameworks, we have, when we talk about action, again, I'll use the example, even though it's a much smaller country than ours, it's only about 6 million in population, and of course, their GDP is stronger, etc. Scotland, that's action. Them actually enacting that and signing that into law and saying, these will be accessible. That's now the kind of action, and it's a step in the right direction. I know for us, action was the amendment of the in 2017 of the Basic Education Act. That was action. Then there's been a lull between 2017, bit of a lull, and then 2020 there was the policy, again another lull. And that's what I keep saying, it's sporadic. That's the biggest issue. If it's not consistent, if the investment in wanting to amplify the rights of girls and women and reproductive health and rights isn't consistent, isn't also supported at a national level, then it falls short of what it is we're trying to do. So what does it mean for menstruating girls and women? It means they have a legal framework, which is, as I mentioned, it's a win. Also, what does it mean for the country? It means that at least now they're starting to pay attention to menstrual health and rights as a key issue. But again, where is the action? Where is the implementation? Where is the inclusivity? Because I know they mentioned persons of disability in the framework, but there's such a wide demographic of people who are not included. When I talk about my book, My First Time, and the reason I did it was because I wanted it to be very many different faces of menstruators, whether you're living with albinism, whether you are Muslim, Hindu, whether you're living with a disability, whether you're blind. I mean, I profiled a woman who's blind. I profiled a woman who's living with HIV. I profiled a woman who's, from the rural area, profiled a woman who's looking after her daughter who has special needs. She has Down syndrome. And she says it's one of the most difficult things was trying to explain to her menstrual health. So are we having materials in Braille? Are they being translated in different languages? Products for girls and women living with disability are significantly different from the products that many other women use. So for me, that's a very big thing, is are we really being inclusive? I also profile men in the book because, we need men involved in the conversation. But the framework needs to be extremely holistic and inclusive. And let's start somewhere. If we can even start with implementing some of what was captured in the framework, if we can also begin to interrogate some of the gaps, then we begin to move. Let's stop stalling and doing start-stop measures and only talking about it on MH Day and then coming back another year. Let's actually have consistent discourse on menstrual equity and rights.
Mm-hmm. Thank you. You've answered even my second question that I wanted to ask you, is basically ensuring that some of the recommendation as far as the policy is concerned. And I believe the other gap is stakeholders at the national level have access to the policy. We know what is entails and all that, but the policy was meant for the women, a woman and a girl at the grassroots level who probably does not even know if it exists. So there's still a gap as far as the dissemination is concerned to ensure that this policy is basically reaches them. The other thing is we are English and Swahili speaking nation, but how do you ensure that even the Braille is translated into Braille, and so that people with disability can have access to it? My other question to you, Janet, is data. I am online looking for data on MHM, and I get a lot of conflicting information. And this, I believe, it's some reason it extends to investing, because if you do not have enough data, then it's difficult for you to put resources, where they ought to be. So how do we, as stakeholders, how can we come together to ensure that we have data that can inform the investment we want for MHM?
That's a really good question. I don't know if I missed it and if Ina has touched on it, because I know she can also shed light on the data gap. But yeah, I think it's, and I think I mentioned a little bit about the Cool Chick report that was released last year, which really spoke to there not being enough data, there not being enough funding. It just almost showed, it was really sad. I think it in comparison to a lot of other social justice and health issues, is a tiny percentage that goes to menstrual health. And to your point, Victor, it's true. It speaks to that ecosystem of, if we don't have the data, we can't put a case, a good case forward. And if we can't do that, then people who have the funding are nervous because they're not sure what exactly they're funding. Also, because menstrual health, the space has 1,000,001 issues within it, whether it's menstrual disorders, disability and menstruation, period poverty, stigma and taboo, religion, culture. It's so many different elements that still speak to affecting and disrupting the lives of girls and women. So, and I think unless the data is able to be available, unless there's investment and interest and scaling of data, and you're right, the numbers are different. I think the Kenya National Bureau of Statistics talks about 65% of women and girls in Kenya not having access to sanitary pads. That's as much as the most accurate information we currently have. The rest is a little bit ad hoc, or people raise their eyebrows. They're wondering, where did you get that from? And it just blows my mind. I don't know why we're not funding and scaling tons of research to get the right data to help us with all the work that we're trying to do. It really does blow my mind. I think it's going to start changing. I know, again, the Ministry of Health they're hearing this noise. That's what's really good. And they're trying to find ways to kind of work with CSOs and different stakeholders in the academia space, in the private sector space, in the media space, to then collectively come together and drive, again, for a campaign, perhaps on being data-driven or creating the right kind of data for this. But it's very scarce, and if it's there, it's very little. And on top of that, we also don't have enough of the dissemination. It's all these siloed kind of insights that need to come together. And in different countries, they need to have national conversations on it, on air, on the digital space, have advocacy through and through. It shouldn't just wait for certain days of the year, because we menstruate every month. There's a woman, several millions right now menstruating, and they don't have to wait for another MH Day to say, okay, let's talk about what's going on. What I have seen in the space, I know you all have been in the space for a while, Victor, Ina, Elsie, and so many others, is what's incredible is even seeing more of these conversations. In 2014, it wasn't like this. In 2015, this for me gives me hope that there's so many conversations happening that even the other day I was on NTV and I was telling Gladys, I was like, this didn't used to happen. Even as I was a news anchor and presenter, it wasn't easy to talk about these issues on mainstream TV. The newsroom would freak out. They'd be like, can't talk about periods. Now here we are. We have a day dedicated to it, thanks to Ina and her colleagues. And now we have these conversations which are going deeper into, yes, we have MH Day, which is so important because we can take stock of progress and gaps. Beyond that, what I'm really liking this year is now there's a focus on, okay, fine, what are we investing in? Where are the investment gaps? When we talk about action, what do we need to see done? Who needs to participate? Who's dropping the ball? That for me is important because it stops being a very broad conversation of, oh, let's talk about menstrual health. It becomes a conversation about, let us create access, information, investment and implementation, and let's do it now. So yes, Victor, that's my long answer about data. There's not enough, and we need it, and we need it now. Yeah.
Thank you.
Can I jump in, Victor?
Yeah, you can jump in.
Totally, Janet. I second you. It doesn't need an MH Day. It's just a height peak in what we should do, and it's just a platform or opportunity. For example, NTV to say, oh, we need to talk about it. In terms of data, what I want to add two nuggets. One is that there's a group of researchers who have just defined the global research agenda. So these are key researchers also working in Kenya and in the region, who have now identified research priorities so that we fill gaps. And the gaps are still multiple, but they prioritize now the gaps and try to seek funding for it, which I think is great. And then in terms of monitoring, there are now more and more tools that help to standardize monitoring and help to say this is what we look at when we talk about wash infrastructure, knowledge, etc. This is really great to have, because that helps us to compare studies, because when you look at research coming out almost daily, they're sometimes really difficult to compare because they use different tools, different measurement indicators, and so on. So by having a set, and UNICEF worked on it, and then there's also another scale that really helps. For example, also the Development Impact Bond in Ethiopia, they're using those standard measures, so that really helps. But I want to acknowledge that these tools can be quite complicated for local NGO and CBO to apply. So these are really more like high-level, larger program indicators where you have experienced and dedicated M&E teams. But it's a start, and if my recommendation is, at least you're aware that these tools are out there, you look at it and sample what you might find applicable, because then you don't have to reinvent the wheel. But overall, and looking now from a global perspective, it's important to standardize the data collection, so we can also compare what's out there globally.
Yeah, sorry, I'll step in again, Victor, only because I have to segue out. No, first, Ina, it's to say we need MH Day. In fact, if it wasn't for MH Day, I can assure you we would not be having conversations this regularly. So a huge thank you to that, to the committee for the work you all do, because what it does is it forces people to confront menstrual health issues and gaps every year. And so I think that has been one of the biggest wins in the menstrual health movement ever, is having a day dedicated to it, and also challenging misconceptions and stigma and norms. And it's definitely one of my favorite days in the year. And so again, thank you so much, Ina, and all the partners who are behind it. I think it allows us to have the conversations. And then my hope is that it also allows us to have these conversations beyond the day, so that we can keep at it. Because I think when we make this a regular conversation, then we really begin, people can't ignore the fact that something needs to change, because it's too loud and it's too in their face. But honestly, I think I'm just incredibly honored to know all of you and to see the work you continue to do. Thank you, because the more we are, I think the more we can shift the needle. And it can be very frustrating and it can be very discouraging, but I think we are starting to see things change. So let's just not tire. Let's keep advocating and amplifying and doing what we can in our own capacity, but let's also do it collectively as often as we can. I'm very sad that I can't stay on for the rest of the session, but I really appreciate the invite. I've really enjoyed myself, and I wish you all a happy Menstrual Hygiene Day tomorrow, and I hope to see you all very soon.
Thank you so much, Janet. Just a quick comment says, I agree with Janet. We have never given menstrual health and hygiene the urgency it deserves. We have to collectively work together. Thank you so much, Mvera Kazungu, and thank you, Janet, for all the work that you have done to support MHM in Kenya.
All right. Thank you all so much. Regards. Bye.
Let me come to Elsie and talk a bit about gender-based violence and ensuring that women and girls are supported. What are some interventions that can be put in place to ensure menstruating women and girls have access to products and information, especially during the pandemic? Because the pandemic has advanced gender-based violence, and in terms of access to information and the products, what is it that can happen to ensure that they have access to the products and information?
Yeah, so like I previously mentioned, this correlation is not something that is new, but I think it's something that the pandemic has sort of brought to the forefront, especially when you link menstrual products and how much it costs and what the mwananchi makes. And so that's one of the things that has been brought to the forefront. But speaking of what can be done, as CSOs, as NGOs, What we've done is step in and try and fill in those gaps. We have the MHM policy that was put in place. It's an acknowledgement, but it's an acknowledgement from one ministry. That's the ministry, the gender ministry. Where are the other stakeholders? The Ministry of Planning and Development, the Ministry of Education. Can we all come together to ensure that access to such products and sanitation, we must remember that these two go hand in hand, that they can sort of come in and provide that. So what CSOs and NGOs are doing is saying, look, we see a gap. We see that you've acknowledged. This is acknowledged, by the way, in our constitutional, in international instruments, within the policy. So it's not something that we can deny or that the government can run away from. This is something that is actually a right to these women and girls. And it's time for us to invest now. And we cannot just leave it to the CSOs and the NGOs to take up that huge role for the government. So it's time to invest now, and for the government to acknowledge it very loudly and boldly, be able to speak about it the way you were saying, the campaign for HIV/AIDS. Can we make it that loud to ensure that then that attention is brought to it? Can we bring in the private sector? Can we work with stakeholders, those who have already been on ground, trying to work towards ensuring that this right is gotten by women and girls. So I think it's something that we do, but there's a myriad of interventions. I think most have actually come up over the pandemic. And one of those that we do as crew is the provision of dignity kits. And it's very interesting because we felt the need that we couldn't just provide the sanitary pads to the women and girls, and particularly to the girls. Like Aina was saying, this is about wash, this is about sanitation, and it takes a lot more. So for us, we have dignity kits, which we have distributed amongst the vulnerable within Nairobi County, Mombasa and Kilifi counties. And what we then sought out to do was have a dignity kit. And like I mentioned, going through such a thing and having to stay in the house for prolonged periods, just because you cannot access such a material is, I mean, beyond some people's imaginations, but it's happening. And so what we sought out was having a dignity kit. And this comprises of a lot of things. One of them, of course, being the sanitary pads, which is key, the sanitizer, a bar of soap, amongst other things, and of course, panties and face masks. So we thought of, can we look at wash and hygiene and sanitation as a whole, and what can we do? But we cannot, however, take up the government's role and escalate it and to enable girls and women in Kenya realize this right of theirs. And so we're calling on investments now. And this is the time. Let's not wait until 28th May next year. Or for, another pandemic or another wave for us to act. This is the time. The women and girls are in need. They're being affected disproportionately. They're being, it's leading to, to violation of other rights, sexual and gender-based violence. So this is something that needs to be addressed, and the address should be not just within schools, but outside of schools. Can we then, I think Aina was talking about this, can we then have menstrual products that are cheaper? Where I'm not having to choose between Skuma Wiki and Ugali of 60 bob, of 60 bob, or buying the pads for what, 90 bob? Can they be 30 bob, perhaps? Then I can eat and live in dignity. So I think those are some of the conversations that we need to have. And this needs to happen with the government, not just as stakeholders that have been there, and it needs to be coordinated. And above all, investment is key. Of course, Aina and Janet touched on this in regards to data. I think that's something that's also a bit lacking, but this is something that can easily be rolled out so that we're able to say, let's invest now. Yeah.
Thank you. Thank you so much, Elsie, for that. I want to bring in Ina and just a conversation about, again, going back to investment. The pandemic has tested the resilience of MHM partners again, and starting last year. And a lot of activities had to move online, and it also showed us the investment gaps that are still there in terms of just ensuring that we respond holistically. So in 2020, the pandemic is here, and a lot of partners have planned international conferences, MHM Day. We're really waiting for this. And then suddenly we are not able to meet. Okay, we have to go online. How did partners respond to this? What was how did we adjust into responding into this? And how did that show in terms of our resilience as partners at a global level? How did partners respond to the change during the pandemic? Yeah,
Victor, I was asking you the question last year, Studio MH Day, how you coped. I remember. So because for MH Day, for example, last year it was completely virtual for all of us. This year we see a mixed bag, which I'm also very glad about, because still there are partners around the world who are able to hold events with girls and women, maybe limited, smaller numbers, sitting more apart. But I'm really glad, because I think these also are, for me, really great opportunities. From a global level, I think, I would say there are a couple of responses. What we've seen is really that the pandemic has really pushed us to think more digital. This comes with opportunities, but also gaps. But I think the opportunities we can see here are like this week are really clear, is that we don't have to travel to meet each other. We can have very cost-effective global conversation and regional conversations without organizations having to find travel budgets to attend a conference. I think from a practitioner base, that's really nice. From looking at for women and girls, we've seen the emergence of videos, but also apps that are targeting. Of course, that takes a little bit longer, but it kept people talking, thinking about how we can push more into the digital area. And there's the Oki app from UNICEF, for example, which has been designed by girls for girls, and I think that's looking really at very low cost phones and systems. So there's been really opportunities, but we've also seen there's still a huge digital gap, especially by reaching people who are marginalized or very poor, because I mean they're not having access to the internet and so on. So what we've seen is that we still rely on volunteers and health workers a lot, and we can't thank them and praise them enough for the work that they do to really reach into each community and into each house to do that. So that's what I've saw, where NGOs weren't able to distribute it themselves. They found ways to work with some other partners. I still think there are still unexplored more creative solutions out there. For example, on distributing pads, just using Coca-Cola crates or something. So there's still more. There's still more to come. So this is like the first coping strategy, like going digital or trying to be really still finding ways. What I'm really concerned about is indeed what you said is about also funding and losing the progress that we had. Because with donors and governments, economic downturns, there will be a shift in priority for sure. And if there's like post-pandemic recovery plans, how do we make sure to have MHH included into this, and how to raise that period poverty is surely increased due to the pandemic. And here, I think it's very different. Each stage of each country, because we see several waves and where you are and you thought the pandemic is over and you start talking about recovery and suddenly you're back into like in India, and you're back into the worst crisis ever. So it will be a hard nut to crack, and I think that we still need to do this together and not wait for MHD. I think again, what MHD does perfectly is that it combines all the voices together and make the choir really loud. But you as stakeholders who are very close to the government, yet now in talking about Kenya, work closely with the Ministry of Health and the Ministry of Economy. If you hear something is happening, you need to mobilize all your actors in the country, work on MHM to drum really loud that period poverty has increased, and use data that is available. Like Unitalk is gathering now data, for example, for girls, and make sure that this is heard. So this might be in Kenya different than in Uganda, than in India or Nepal. But I'm really a bit concerned that priorities will shift if we are not loud enough.
Collective voice. We need to, have a collective voice so that you can pressure the different stakeholders. And one of the things that I saw online, was to call for action in terms of getting commitments. And that is a very, very big campaign that I think we should take seriously, because if we have commitment from governments, we have commitment from, I'd say, celebrities, actually. If we even have commitments from them, then that means we are talking collectively as one, and then we cause impact. Systems thinking, it requires us to work together to change that. There's so many questions that are coming in and comments, and I want to spare the last few minutes just to go through the questions and comments. Please feel free even to share some of the things that you as an organization did during the pandemic. But Ina, you've alluded to this. Vincent asks, Ina, at what point should CSO start pushing for menstrual health and hygiene to be included in the national discussions as an agenda?
Yeah, I think maybe Vincent, you meant probably the SDG agenda, because here in Kenya, you already kept pushing since 2014, as also Janet explained, about the integrating of MHA into different strategies, and now you have your standalone strategy, etc. So frankly speaking, the SDG, so there are two opportunities. One is for the SDGs, as I said, the joint monitoring program is starting to collect data, and here UNICEF will be a very good ally to hear. I don't know if Agnes is here on the call, but you know her, to work with UNICEF, because they're really closely aligned with the government and on national monitoring system when they're doing it to position Kenya as a country that is willing to go. As for the SDGs, I don't think the discussion will come, I will usually start 3 years ahead of this review process. And that's why when also the new definition of menstrual health, menstrual hygiene management came up, and some indicators. And these are really high level discussions, which are difficult to find who is engaged, even for us. But I think your best bet here in Kenya, I mean, you have a policy, you have champions within the government, you have UNICEF was really strong on this. We're usually close. You have then also UNFPA, who's also really engaged in the region, and who are sitting close to those processes. So keep on pushing always. I think as you have a coalition of partners, again, I can only reiterate, that's good advocacy. You have a single message that you want to convey. If you recognize that maybe next year or in 3 years or in 6 years, your advocacy goal is to push Kenya to ask for more monitoring or ask for SDG pushing, you just do this as a collective collective voice. But anyway, do this throughout. Doesn't have to stop.
Elsa, I'm going to come back to you in a bit, but Ina, you've said something that is very important, that sometimes it's difficult to know what is happening where. Going now as MHM Secretariat, is there like a global reporting system that partners can use to report their activities, either monthly, quarterly, annually, and all that?
Good, very good question. We tried in 2019 to do an annual report on education targets, like goals and targets. And I think that was for us a first step to gather data that was not collective anywhere. So organizations who are educating adolescent girls, that was defined by us, were saying, okay, in 2018, we reached X amount of girls. And in 2019, we commit to reach X amount of girls. So it was 2019? No, it was 2019, 2020. So with that, we called it the Action for Menstrual Hygiene Education. We're able to demonstrate how much is done, how much partners are committing, and also the gaps. So that was our attempt. And then the pandemic happened. And with that, we knew education wasn't able to take place because schools were closed. So people couldn't hold up their commitments, which was really, really, really sad, really sad. But I think that was one of the first attempts. And overall, we would love to do it again once we as the global community get into a little bit more settled things. And talking about numbers of girls reached is relatively easy. We don't talk about impact. You don't talk about how many girls have then changed knowledge, but just doing that is great. I mean, we doing this for other areas, like how many pads have been donated and so on, could be easily set up, but I think pad donations are a bit, how to say, could be. But for now, we don't do this because we know a lot of people are struggling to make commitments and so on. Let's hope we can do it next year.
Thank you. I think that will go a long way into collecting enough information. So you would see which partners are directly working with the government, what's happening at that level, and even the commitments and everything else. Elsie, let me come to you. Just linking again gender-based violence and access to the menstrual products and information. A lot of cases, some of these victims, so the victims specifically, their cases are not reported. One, maybe because they do not know how do I do this? Mm-hmm. It's not even the victim, sometimes the witnesses or the people who see this happening, there's no clear systems as to say this and this is happening, and all that. The other thing is, again, we are talking about menstrual hygiene products. So this is a victim who has been locked probably in their house, and they cannot be able to get access to the products and everything else. What can be done to ensure that we collectively support the victims in all the areas, in terms of giving them the products, in terms of giving them information and that?
I think I'll just touch on what Ina mentioned in terms of knowledge rollout. I think, like I mentioned, the pandemic highlighted the need for us to talk about and highlight menstrual hygiene. But really, when you think about it, are we talking about it at the grassroots level? And again, it comes to what Ina and Janet were mentioning about the local CBOs who are very valuable to us, the community champions who are working with these women and girls. How have we empowered them to be able to spread that knowledge? I think other than the provision of those dignity kits, can this be in the curriculum at school? can we talk about it that openly as a sort of learning and knowledge sharing? So I think that's one of those things. But speaking of what can be done and what we can do, Crew has a toll-free line. And on that toll-free line, once you're able to call, I think I'll put it on the chat box, but I'll also just say it out slowly for those who are writing down. 0800 720 186. I'll repeat, 0800 720 186. When you call this line, particularly not just for survivors, but anyone who, because what we do is prevent and respond. So like you mentioned, if you see someone who is at risk of, the toll-free line is right there, is at risk of gender-based violence, then you can easily be able to call that line. What you'll get is then free legal advice and general advice. You can be referred to a safe space for our survivors. You also get legal information and representation. Yes, we do have advocates who are going to court, and we also have counselors. Like you mentioned, not be able to leave the house for 3 to 5 days for a reason that is beyond your choice is something that can have a lot of psychosocial effects. And so those are some of those things that we speak about, the power imbalance between the provider and women and girls generally. So I'd say those are the services that we do. I know we're not working in isolation. There's a number of CSOs who are also doing the same. Reach out, ask whatever question. I know someone on the Q&A was asking whether there are partners who are also supporting CBOs in provision of dignity kits. Yes, we are. Do reach out. We do support from time to time where we can. So kindly reach out to our toll-free line, ask about that. You'll be directed to the right persons. Thanks, Victor.
Thank you, Elsie, for that. One of the big conversation that the world is having, and some countries have started adopting it, is reusable sanitary pads, and it took a very long time for Kenya to develop the guidelines. I think it was last year, actually, the guidelines came out in Kenya last year. And manufacturers, social entrepreneurs who are producing the menstrual products are still having a very difficult time in some countries, actually, for this to be accepted. One, maybe because of the cultural taboos and all those things that are happening at community, the policies at the national level, and even the quality of the menstrual products, especially the reusable products. Nicera, I think this question was also to Elsie, and maybe you can touch a bit about it. Is the pads are expensive, okay? And then why are they expensive? Okay, can reusable pads complement the disposable pads? And if so, how do we ensure that they are good to be used? The other comment that is coming in, can the panelists touch on reusable pads, linking it to sanitation and hygiene? So I'll start with Ina, then come to Elsie.
Okay.
So this is a question from Vera Kazungu and Nicera Wanjiru.
Thank you, Sarah, and thank you. The other, I forgot the name. Yeah, so I'm a big fan of reusable products out of several reasons, but I just want to emphasize in the beginning, this is a matter of personal preference and also choice. And you can make the choice when you know what are the advantages and disadvantages. And sometimes it's also a matter of price. So I also choose whatever I can afford and whatever I like and is good. So there's so a reusable, it might be a good product that I like, but it doesn't mean that another person likes this either. So I always want to bring this up front because it's important. And then there are like two reusable types. There's of course the washable pads, reusable washable pads, and there are also menstrual cups, which are also partly available in Kenya, also through NGOs. And let's look first at the washable pads, because, and you're right, Victor, with the standard. I think that filled in a missing gap, because we're not talking about the pads that are created by women themselves or sewn together. We're talking about pads that are distributed by social businesses and imported maybe, and who are also more or less on the market. So I think you know some of those brands. And it was really important, vice versa, for the companies as well, for the consumers to have standards available. So the standards guarantee for the user like the quality, that they're absorbent enough, that they don't contain any harmful chemicals, and that they undergo a testing before they come into the market. So I think that from a user perspective is super positive. And they also come along with standard guidance, what needs to be on the package, and the information, how long to wear them, and how to wash them. And that's important. So it also then guarantees for the companies is kind of like they know then what to do and how to put their products in. So I think so for they're great, because they can last for long. Of course, like the upfront costs are more expensive. Like if it's the same with a lot of other consumer products, right? If you have to buy a pad for 100 shillings, or if you buy monthly for 10. So how do you get this upfront money? And I think that is something that hasn't been really tackled yet, unless NGOs sponsors or distribute it, because in the end it's cheaper in the end. But how do pure people can upfront that money? So I think there's a lot of. I also want to emphasize with a standard, those reusable pads doesn't come across as a second option. So, or as a low standard option compared to disposable pads. So women shouldn't feel they get a second-rate product only because it's reusable. But with that standard, you can see that this is a good quality product, and it's just it's a different type of product. So that is fine. I think still we need to discuss like washing and drying for those products, how these are. But with disposable, we also have to discuss how to do the waste management of disposable products. So all products come with advantages and disadvantages for the users, and this needs to be taken in consideration. But the standard is a great step already. When it comes to menstrual cups, that's a totally different story. Because they're insertables, it's really they're even more expensive, but they also even last longer. They're much more an issue of choice, because as they're insertable, some women like this a lot because they're comfortable. Most of the women doesn't like it at all, but have to try it. But how to try something which is so expensive? So it's like it's really a bit tricky with those. But in the end, it's all about making this accessible and affordable. And for making this affordable, we need a little bit more creative to make expensive products, reusable products, more affordable. We need to think about other finance mechanisms like down payments or so, but this doesn't exist yet, as I know, nowhere as of now, nowhere in the world.
Nowhere in the world. That is so true. I know one of the things that we best practice is to give the woman and the girl a choice to choose what products suits them. And I think for us as stakeholders, that is very key, to allow the woman and the girl to choose which menstrual products they would like to use. Elsie, Nesara again is asking, just wondering why sanitary pads are very expensive.
Why?
Yeah, and I think
Elsie, please.
Go, Elsie.
No. I'm happy for Elsie to answer. She's a great panelist. So please go.
No, she was asking why sanitary pads are expensive, and I think for me, just to mirror what Ina has said, that's what I was coming to. I think in terms of access to sanitary products, our key thing should be that the price should not influence the access of the woman or girl to access this. I mean, you've recognized it as a right in your own constitution, in the policy, in international instruments. So why then are you making it expensive? Why should I base my choice in terms of the amount of money that I may or may not have? So I think for me that is key. The money bit takes away that right. And it's something that we really need to discuss in terms of standardization. And even just to mirror what Ina said in terms of reusable, disposable, washable, and all that. I think the key thing here is standardization and sanitation. So even if there's an affordable option right now within the community, deep within our communities, then are they standardized? However they come in, is the packaging informing you of how to use it and etc. And this speaks to wash in general and hygiene. So that's what I'd say about the price. Yeah, they're quite expensive, especially in Kenya, and I think that takes away my choice as a woman, and particularly my right, because then I'm thinking in terms of money, whereas it's something that should be easily accessible. You've recognized it. Let me be able to access my right to sanitary products. Yeah.
Thank you. Ina, I'm going to ask you this question in a bit in terms of your global experience, especially when it comes to the price of menstrual products. Okay. Are you able to comment on that? I mean, which the country that probably has, just anything as far as the prices are concerned.
Yeah, Ina, I'd also love to hear your thoughts on this one.
So first of all, I'm not an expert on products and prices, but what I can say, I'm part of different networks. So there's a great study that compared GDP with prices of products. When we talked also about taxes, because we made this global repository on period taxes, and as part of that, research has done a study also on taxes and prices and compared GDP with prices, and it was really interesting. And very unfortunately, prices for menstrual products are often higher compared to the GDP in least low and middle income countries than in high income countries. So from a global perspective, that's I can link later or share with you later, Victor, the link if people are interested. And also, so that's been really fascinating to see that, but actually it's quite sad. The prices, it's a little bit about so what I can say, and then also the Reproductive Health Supply Coalition is having a talk right after, back to back here. They're looking at markets for menstrual products, and with that, they also want to increase access and affordability. These are closely linked together. That doesn't necessarily mean if you have better access, the products will be more affordable and vice versa. But I think access is a key component. And clearly for companies to, why are they so expensive? So it's a tough question, but I think because the market hasn't been very big, they market it to people who can afford it, and that's why they're more pricey. If you are able to reach a to lower income, then prices will drop down because that's your customer base that then will pay it. With that comes, unfortunately, often lower quality, which we also don't want. And there's been a huge movement, I think, in Tanzania, maybe that swapped over also to Kenya, about P&G pads that they were really complaining about the quality of those pads, and has also been with imported products. There's been sometimes it's really difficult to source materials because they're all imported. So you're dependent on global market prices, for example, for wood pulp and for other stuff, and depending on the dollar, that also changed. So there's a lot of influence factors. However, I think when we see that affordability is a key bottleneck to making products affordable, there are mechanisms that the government and Ministry of Finance, especially, and through public-private partnerships that you can still work on, like import tax removal on products, establishing better markets, transport costs actually to the remote villages. That's a key contributing factor to costs, because you have to transport them into the rural areas, and like from Nairobi, which is expensive, given that fuel is expensive. So there are ways to get the costs down, and I hope that this study by the Reproductive Health Supply Coalition, looking at markets and access, will help to identify some of those things. I think they included Tanzania and Nigeria as key countries to look at, but the learnings, I think, from Tanzania will be very similar to Kenya. And once it is ready, I'll make sure to share this as well.
Thank you. I know in Kenya, at least last year, but one, they removed the taxes on raw materials for pads, and that we should start, to see the effect on that, because the prices are still a bit 50 shillings and above. We've not started seeing the effect yet, so we hope soon we'll see that. Thank you so much for your comments and your questions. Dennis from Gifted Community Center, that's a non-profit organization in Kibra. We deal with persons with disability, and there's a very big gap on menstrual health and dissemination of both information and products. We need to do better as a country, get the exact data, and find means to really bring the change to the ground. It will also be interesting, Dennis, to share with us what you did during the pandemic to support people living with disability, but that's a very important observation. Lucy Nkatha says, for it's not about money, but you can have accessible wash facilities using indigenous knowledge and locally available materials. So sometimes we expect to have these very expensive materials, which are again expensive. So hence we are not able to have the wash facilities. I know the government, at least the Ministry of Health, they have the ODF, declaring communities ODF free and all that. So maybe looking into that and how we can support the communities. There's a gap when it comes to menstrual hygiene in regards to persons with disability. That is Dennis Kaburu. Thank you for that, Dennis. And yes, person with disability, again, it's that people are usually forgotten when it comes to this, and even the interventions sometimes. And I think I was challenged last year, if we give them menstrual products, how do you ensure that the person with disabilities have them? And the person came to our office and noticed that our office was not very friendly to persons with disability as well. So investment in that is also very key. In MHM is paramount as it affects all the other factors, that is health, education, and general participation for women with disability. That's again Lucy. We talk of menstrual hygiene and wash in general. A lot of awareness around accessible wash must be targeted at the grassroots community level. And then Alex, are there any partners? I think Elsie answered this question. Yes, I think that is what's coming. Oh yeah, Elsie, there's another question from Roslyn Kambana. So last year or 2 years ago, the government transferred the National Menstrual Hygiene Program from the Ministry of Education to the Ministry, I think, of Public Service, Youth Affairs. What do you think will be the effect of this And in addition to that, you talked about including all stakeholders in working together to support MHM. I think, Josephine, what is your thought on that?
I think that's a good question and observation. Like I mentioned, we want to bring everyone together. This is something that is happening not only to girls, but to women as well. And the age range is so big on menses, and so it touches on women, or it touches on women in all spaces. The effect of that, then it becomes a you problem, whereas it's a problem that is touching on a myriad of women from as young as 11 or 12 all the way until menses stop. So I think the disadvantage with that is where we're saying that's your problem, that's your responsibility. And you see, tasking it to the Ministry of Education is then saying this is for people who are going to school. How about the 20-year-olds who cannot access that as well? So it's basically saying we're leaving them out. It's something that needs to be collective. It can't be left to gender as well, because it's not just a women's issue. It's a we issue. We all need to come together collectively, like Janet was saying earlier on. Those are my thoughts, Victor.
Thank you, Elsie. Ina, just as we come to the conclusion of this conversation, a lot is happening now. I know you guys are now very, very busy. A lot of information coming in. The big day is tomorrow. Just give us a picture of what trends are you seeing right now?
Good question. We just talked about it. That's why I was coming late. Big trends is that we have slightly more trending than last year. So the numbers is bigger, with a caveat that we don't see much engagement from India yet. I mean, India has been also one of our largest supporting countries with events and social media. And given that they're in the big Corona wave, we also really see that, because that's what, as I said, so what I'm really glad about is to see a mix of online events, but also already on the ground event. That's great. Big theme for this year is period poverty. I think also because of the pandemic, where girls and women have really suffered, and to respond to that, period poverty is really a big theme. While some countries like Kenya, who are much more advanced also in the agenda, are pushing for the theme of action and investment, which is also great. So what's going to happen we will see what's happening tomorrow. So I hope everybody wears your bracelet tomorrow and post a picture online. That's really your own personal challenge that you can do this, despite what you do as an organization. We also will host on Thursday next week, Studio MH Day. That's going to be from 3 to 5 East African time, live on our website. So no registration required, you just tune in. And what we'll do is we'll share highlights and stories that we saw from MH Day. We do it a little bit later, so as like in a sports match, you talk about it afterwards, not while playing. So in order to not disturb the game, let's say like this. So we want everyone to celebrate tomorrow and not divert the attention to us. So that's happening on Thursday from 3 to 5 East African time. So tune in, and if you share, I'll share my email in the chat box. If you have bracelet pictures or great event pictures, please do share those with me so we can put it up online, like on our website. And if they're really brilliant, they might even make it into the highlights in the studio. But I want to see everything. So I always like to see the diversity of images and celebration, because that keeps me happy and driving MH Day every year.
Talking about bracelets, I have mine here, Ina.
Yeah.
just share a bit about this bracelet. Because some of us, we're probably seeing it in posters and the banners that you send, but I don't know much about it. So please share more about the bracelet.
Yeah, so the menstruation bracelet is actually is a sign for menstruation, and as the signs and symbols are really powerful, like the red ribbon for HIV/AIDS, like they really you associate then a topic and you show that you care for the issue and care for people who are associated. And by wearing a menstruation bracelet, you show that you're not shy of talking about periods, and you make a statement that this is important for you. Or you hand this over to someone and make them aware of the challenges, and that also they should not shy away about periods. The bracelet itself, it doesn't have to be the beads like we do. We've seen it, you can do it from whatever materials you have at hand, as long as it has 28 elements, out of which 5 are red or pink or a different color. So we see like flowers, we've seen papers. I painted it with lipstick and toothpaste on my wrist. I've seen people using corns and like different colors of corns to bring together. So really, you don't have created from whatever, as long as it shows like this 28 elements, and then post a picture online and so on. It's what we've seen. It's a great tool to engage your colleagues who are not yet engaged to in a discussion or in events, to do this, build this together and talk about the menstrual cycle, even if the cycles are all individuals. But we also use it to engage decision makers. So we send the bracelet to our ministry, and we hope that our state secretary is posting a picture this Image Day wearing a bracelet. But we've also seen that already from Denmark and Canada, and also other people are wearing it. So yes, wear it tomorrow, but of course wear it every day, because as Janet said, every day we should talk about the issue every day. But specifically on this day, it's really powerful, I can say, and it's beautiful too.
It is so beautiful. You know, I have had mine for like 3 years now. Yeah, I love it. So over to you, Elsie. Just closing remarks, please.
Sorry, I was muted. I was saying I'm grateful and honored to be part of this conversation. It's something that I hold very dear. Happy to be working at a place that values the same. Please don't hesitate to reach out to us on our toll-free line. I'll just put it down again. Other than that, you know, Crew is celebrating tomorrow in a big way, supporting our stakeholders, our CBOs. Tomorrow, and even going on to Saturday, we'll be in Kibera and Mukuru, and hopefully in Dandora communities. So please follow our pages online at Crew Kenya on Facebook, Twitter, YouTube, just to see what we are doing or planning to do tomorrow. Reach out in case you would like to know more about what we do, and to form more linkages and perhaps support for those CBOs that were asking. Please don't hesitate to reach out. Let's celebrate tomorrow. I'll get my bracelet or something of the other, Ina. But yeah, thank you, Ina. Thank you, Victor. I already said my words with Janet. Yeah, thank you so much for joining us and taking time. Yeah.
Thank you. Thank you, Elsie. I want to bring in Ina just to share a bit about the commitment. How is that? How should we get involved in that? The MHM commitment. So, Ina, please.
Hi. Yeah. So if you have, if you work with local governments or yourself, so because we said it's time for action. And action means making a commitment for the next 12 months. So if you've, for example, as an organization, commit to reach 10,000 girls or to donate 500 pads within the next 12 months. Please share this with us. I think there's even a link on our website. I'll have to figure out. Or even better, if you work with a local government and you tell them, look, it's great that you talk about it, but we want to hear your concrete commitment, what you do. Could be that, it could be also very simple that they say, okay, we're going to establish a working group on menstrual health. Great commitment for a local government. If they say we're going to put budgets into menstrual health and hygiene for the next year, even better commitment. So it's anything that is a little bit more tangible than just saying, oh, it's an important issue. So if you have this, please submit this to us, either through the website. Of course, you can also write it to me. It's a test balloon this year, Victor. So we'll see how it goes, but we're very committed ourselves to do this and push this the next years, because we're ready. We as a community we need to walk the talk.
Thank you, Ina. We are very committed, and I know everyone represented here today is very committed. And I would like to thank you, thank you everyone for joining us. This webinar was brought to you, crew in partnership with Garden of Hope Foundation. And we are so grateful also to our panelists, Ina from the Global MHM Secretariat, Janet Mbugwa, Inua Dada, and Elsie, Crew Kenya, and myself, Victor Odhiambo, co-founder, Garden of Hope Foundation. So thank you so much. Again, if you are in Nairobi, if you are anywhere in Nairobi and you don't have anything to do tomorrow, join us in Kibra. Tomorrow, Olympic MHM Day. Welcome you all. Please join us from 9 a.m. all the way to 1 p.m. Great conversation. We'll have lots and lots, and so see you then. KAG Olympic is located at Olympic Estate. Get there and call me or reach out to Elsie, and we'll be really happy to host you. So see you tomorrow. Thank you.
Thank you, Victor.
So much.
Thank you, Elsie. Also really great contribution. Loved
Thanks,
it.
Ina. Thanks, Victor.
Cheers.
So,
Bye-bye.